Risk factors for breast cancer. There are several risk factors that increase your chances of getting breast cancer. However, having any of these doesn't mean you will definitely develop the disease. Some risk factors can't be avoided, such as family history. You can change other risk factors, such as smoking. Risk factors for breast cancer include age. Your risk for developing breast cancer increases as you age. Most invasive breast cancers are found in women over age 55. Drinking alcohol. Drinking excessive amounts of alcohol raises your risk. Having dense breast tissue. Dense breast tissue makes mammograms hard to read. It also increases your risk of breast cancer. Gender. White women are 100 times more likely to develop breast cancer than white men, and black women are 70 times more likely to develop breast cancer than black men. Genes. Women who have the BRCA1 and BRCA2 gene mutations are more likely to develop breast cancer than women who don't. Other gene mutations may also affect your risk. Early menstruation. If you had your first period before age 12, you have an increased risk for breast cancer. Giving birth at an older age. Women who don't have their first child until after age 35 have an increased risk of breast cancer. Hormone therapy. Women who took or are taking postmenopausal estrogen and progesterone medications to reduce their signs of menopause symptoms have a higher risk of breast cancer. Inherited risk. If a close female relative has had breast cancer, you have an increased risk of developing it. This includes your mother, grandmother, sister, or daughter. If you don't have a family history of breast cancer, you can still develop breast cancer. In fact, the majority of women who develop it have no family history of the disease. Late menopause starts. Women who do not start menopause until after age 55 are more likely to develop breast cancer. Never being pregnant. Women who never became pregnant or never carried a pregnancy to full term are more likely to develop breast cancer. Previous breast cancer. If you have had breast cancer in one breast, you have an increased risk of developing breast cancer in your other breast or in a different area of the previously affected breast.